to be available next month and is the first to be produced in the developing world. Fez Jamil reports.
It's children who live in poor areas like this one in New Delhi who are most at risk of infections, many of them preventable. Reenu's 5-year-old daughter died a few months ago from severe diarrhea. She says it's impossible for people like her to protect their families from threats like this.
Of course I'm angry, because if the water was clean, if the outside was clean, why would my daughter die? Why would my children fall ill? We don't have money to treat her in a fancy hospital. For poor people like us, this is what happens.
Unsanitary conditions lead to more than 300,000 child deaths from diarrhea in India every year. 1/3 of those are caused by this, the rotavirus, which causes severe diarrhea in infants and young children. Most of India's poor don't have access to available vaccines. Now this lab in Telangana state has developed the first vaccine for the rotavirus made outside Europe or the US. At about $18, vaccines available on the market are too expensive whose children are likely to be infected by the rotavirus. The new vaccine developed at this lab will cost about $3, making it more available for those likely to be infected here in India and across the developing world. In clinical trials, the new vaccine is shown to be about 58% effective, similar to other rotavirus vaccines.
People now recommending you don't want.
But its makers say it's only part of the overall solution.
It's a country of India, 1.2 billion. It's just impossible to clean up everything overnight. But this is part of the sanitation program. If you combine with this and with the sanitation, you will get instead of 58%, you may get even 100% efficacy.
Those who work with the poor agree, saying simple steps can make a big difference.
Like boiling water, like hand washing. Breastfeeding is also really important because mothers use dirty water with our milk powder. So we can really make a big dent in reducing these number of children that die through these simple interventions.
Health workers are trying to deliver that message on the ground, hoping that along with the potential of a cheap vaccine, children in these areas won't become another statistic. Fez Jamil, Aljazeera, New Delhi.